from the PIIC Center, infectious disease expert, Dr. Donna O'Neill. Good morning, Donna.
Good morning, Bart.
Welcome back.
Thank you.
No Andy today, so.
That's okay, we can handle it.
Yeah, maybe Andy will text in whatever his current health emergency is. So we had a very dry month of June. Mm-hmm. And the good news for that was not a lot of mosquitoes because they breed in standing water, mm-hmm. right? Mm-hmm. But we had 2 inches of rain on Sunday.
And this weather's perfect for it. Mm-hmm. Hot and muggy. So yeah, I thought we would continue on with our summer theme from last month when we talked about ticks, and this month we're going to talk about mosquito-borne diseases.
Wow, mosquito-borne diseases.
Yeah.
They're bad enough just being biters, but they can also carry disease.
Yeah. So in the United States, 2 interesting things have happened. Last November in Arizona, there was the first case of dengue fever reported acquired domestically in the U.S. and Arizona. And now there are some reports, it's still extremely low, of malaria in the United States. So most of the malaria is imported, either from Africa or Asia, but there were 4 cases from Florida so far, and 1 from Texas. That's for infectious disease doctors, this is kind of exciting news. So we've had malaria before in the United States.
Oh, we have?
Yeah, back in, I think, 1923, there were 2,300 deaths due to it. But they got rid of it in the early 50s because of 3 things. They used insecticides, such as DEET. They filled in ditches and did a lot of work in that respect. And screens. Screens was the big one. Everybody was recommended to put screens up. So the public health department, got rid of it. There have been a few scattering cases. I think about 20 years ago, there was a handful of cases, again in Florida, in Palm Beach County. But this year it's in Sarasota, and the case in Texas is in the most southernest part of Texas. And there was only probably 2 cases in Texas, but the 1 person who was sick didn't get tested.
So I've heard of dengue fever because I'm old enough to remember the Vietnam War. It seemed like that was a big problem for troops. But malaria also, it's fully associated with war.
True. And so nowadays we typically see it in people who've gone away on their exotic travels, and that's picking up again. We know all the airports are busy, and believe it or not, summer is the biggest month for imported malaria, and sometimes it's actually people going back home. So many people have the false notion that they had it as a child and they're immune and they don't take any preventive medicines, and they come back. And they believe maybe that's how it gets started in the United States because it's transmitted by the female mosquito who has to pick up the parasite. So it's typically going to be from someone who has traveled overseas. And then the parasite replicates inside the mosquito. And then when it bites you, it transmits the disease to you. And you typically get sick 1 to 4 weeks later. So sometimes it's people who are coming home from their travels. Mm-hmm. And then the mosquito, if it's bit 1 person, it might have bit a few other people. So we might just be, starting something. But again, the risk is extremely low. But the CDC put out a nationwide health advisory, and Florida is under, a state of, mosquito alertness. So they've concentrated in Sarasota, and I think they found the area. It was a swampy area, and they take all these mosquitoes, and they found 3 in this 1 swamp area. So of course they've dealt with that. So hopefully that'll be the end of it. But just to remind us that these diseases exist. And malaria, I respect malaria, it can kill you. So it can kill healthy people if it goes undiagnosed. And it's pretty easy to diagnose it, but you have to think about it. And most of the times, you don't ask, have you been away traveling anywhere? So that's a key question. And it's pretty easy to treat, provided we have the medicines. So a lot of hospitals don't stock the medicines that we need to use for this disease.
Over the weekend, I saw quite a few stories about the number of Americans traveling abroad. It's at an all-time high. Mm-hmm. It's like people have gone crazy. And I've seen photos in Rome of Americans just swarming the Vatican, further damaging our reputation as tourists. But because we are traveling so much more, is the risk higher? Is there greater chance?
So especially if you don't get travel advice. So within my own family, my son's going to be traveling to India in about 10 days' time. And another son just booked a trip for Florida for next, February. So yeah, travel is really picking up. So some people, should be getting some travel advice, which of course we do at the PIIC Center.
Do you recommend, are there shots that people should get before they go?
So it depends where you're going, and a lot depends, how long and your underlying health. Getting back to these mosquito-borne diseases, this is not to alarm you, it's just to make you aware, and there are precautions you should take, even here in Michigan. Because in Michigan we have the West Nile virus, which the health departments are just starting to pick up. Normally it's not in Jackson, it's normally the Detroit area and Kent County. So obviously our statistics are always behind. So, especially from dusk till dawn, you want to be using insect repellent, typically something with DEET in it. Long sleeves, long pants, helps a lot. Obviously, if it's really buggy, go indoors. Make sure your screens are intact. In some areas, they have to spray. If you're out camping, mosquito netting is often required, especially if you bring in little children along, over babies, cribs and whatnot. And then again, the standing water. So every week you should go around and, all that water we got on Sunday, pour it out.
Tip over the tires that are in your front yard every now and then.
Or your buckets, or, bird baths, or if you have a pet dish that has accumulated water.
The pet dish.
The gutters, sometimes you need to attend to those if there's a lot of leaves.
Now, will they go, because we have all these bodies of water in Jackson, lakes and rivers, and does that type of water serve as a breeding ground?
It's more standing water, so when I do my morning walks, there's a couple of these little ponds that are sometimes now have a lot of algae on top of it, and as I go past it, it's like, those are mosquito breeding grounds. But again, we don't have malaria in Michigan. We have other things like West Nile virus. And West Nile, 8 out of 10 people have no symptoms whatsoever. The other ones, get sick, nondescript, fever, headache, aches.
Like
sometimes they get a rash, sometimes a little bit of nausea. And that's as true for a lot of diseases.
Like Lyme disease.
Like Lyme and even malaria, So that's how malaria presents.
So what are the symptoms of malaria? What will it do to you if you don't get it treated?
So basically it's going to destroy your red blood cells, and oftentimes it gives a lot of liver inflammation and damage. But it's because you get very anemic. That's where most of the damage is done. But the rule of thumb is fever in a returning traveler, it's malaria until proven otherwise. And it could be other things totally unrelated, but I've seen it. It was in a missionary family. They stayed an extra month in Africa, and when they came back, 3 out of their 4 children died due to undiagnosed malaria. So I respect it. And before you go, some of these places you need travel advice, because there are some medications for malaria, for example, that you take. It doesn't actually prevent malaria, because that would have to prevent the mosquito from biting you. It's having medicine on board that it's preventing you from getting sick from malaria. It's going to kill that parasite if you should get by the female mosquito that transmits it.
And you know that medicine, and you can prescribe it?
Yes.
Oh, wow. A few years ago, I was up north, Crystal Lake, and they had signs where they said, this part of the lake is susceptible to swimmer's itch. And I always thought that was just something that you got in a lake, but someone said, oh no, it's insects. There's something in the lake that's...
Well, it comes from snails, and actually you don't have to go up north. We have it at Clark Lake at times.
Oh no.
Yeah. So, and there's unfortunately no specific medicine for that. So malaria, there is specific medicine. There's a vaccine, but it's 30 to 40% effective, typically given to children in Africa, which bears the brunt of most of the disease. And on average, it kills 600,000 people a year. Yeah.
So there are...
worldwide, that is. Yeah.
Yeah, so the tropics, and you always hear about third world countries where there's high incidence of malaria. And I think during World War I, there was, it affected a lot of the troops. So the tropical, because we're getting warmer.
Careful there. That may be one factor, but that hasn't been shown. But yeah, it was always a mystery why, Florida and parts of Texas, it's in the same latitude as some of these other countries that have it. And I think a lot depends upon, what we've done, the screens, the ditches, and the insecticides. I think that's the big difference.
So we didn't have, we put windows in houses, but we didn't, screens were a later invention.
Seemingly.
Apparently.
It was before my time. But preventable. So, and it was really simple means. So just be aware. And yeah, we've seen an uptick in the tick-borne diseases, which we talked about the last time. So the big thing that I've heard is the rash can look like anything. So it doesn't have to be that bullseye. It could look like a little patch of sunburn even. So keep thinking about these diseases. Stay safe.
I was in a store, and it was a gardening store, on Monday, and they had a rack with all kinds of insect preventable things, sprays and stuff, but they had something called tick tweezers. Now you don't have to have special tweezers to remove a tick.
No. So you just have to pull it straight up, try to get it all out. Yeah.
How was your 4th of July?
I worked.
But
that was okay.
Really?
I did, yeah. So coming off a bit of a stretch.
Did you have any 4th of July foods or do anything 4th of July-ish?
You mean in the office or at home?
Either.
Both, yeah. So we have kind patients. Someone brought us in a whole tray of cupcakes that were all decorated. Yeah. I got to enjoy. I didn't have to do any of the work.
And what about at home?
That's what I said. I got to enjoy. I didn't have to do any of the work because I was working all day.
Hot dogs. More Americans consume hot dogs in July than
I heard that.
Month.
It's Hot Dog Month. Yeah.
National Hot Dog Month. Yeah. Well, thanks for the advice. I think no one likes mosquitoes to begin with, so doing all those things to avoid them can avoid a lot more than just annoying bites. Thank you very much.
Stay safe. Yes, thank you.
From the PIIC Center, infectious disease expert, Dr. Donna O'Neill. Stay tuned. We're going to meet a couple of champion fishermen next on The Morning Show.